తలనొప్పి, నరాల బలహీనత, మూర్ఛ వ్యాధి, పక్షవాతం, బ్రెయిన్ స్ట్రోక్, బ్రెయిన్ ట్యూమర్స్, మెడ, వెన్నెముక సమస్యలు, పక్షవాత సమస్యలకు పరిపూర్ణ వైద్యం. మన దేశంలో ఎక్కడా లేని ఆపరేషన్ థియేటర్, అమెరికాలో జరిగే వైద్యం ఇప్పుడు గుంటూరులో. చిన్న కోత ఆపరేషన్ల ద్వారా కేవలం 2 రోజుల్లోనే డిశ్చార్జ్. డాక్టర్ రావ్స్ న్యూరో హాస్పిటల్, గుంటూరు. సంప్రదించండి 9010056444, 9010057444.
25 commonly asked questions about seizures, along with answers by the expert epilepsy surgeon, Dr. Rao. What is a seizure? A seizure is a sudden, uncontrolled electrical disturbance in the brain that can cause various symptoms, including altered consciousness, convulsions, and unusual sensations. What causes seizures? Seizures can result from various factors, including epilepsy, head injuries, brain tumors, infections, and certain medical conditions. What is epilepsy? Epilepsy is a chronic neurological disorder characterized by recurrent seizures. There are many potential causes, including genetic predisposition. Can seizures be fatal? While most seizures are not life-threatening, some can lead to complications. It's essential to manage seizures properly to reduce associated risks. What are the different types of seizures? Seizures are categorized into various types, such as focal, partial seizures, generalized seizures, and absent seizures, each with distinct characteristics. What is the first aid for a person having a seizure? During a seizure, it's crucial to keep the person safe by preventing injury, easing them to the ground if possible, and placing them in a recovery position. Can you swallow your tongue during a seizure? No, it's a common misconception. While the tongue may move during a seizure, it's not possible to swallow it. Can stress trigger seizures? Stress can be a seizure trigger for some individuals, particularly those with epilepsy. Stress management can be beneficial in such cases. What tests diagnose epilepsy? Diagnosing epilepsy typically involves an evaluation of the patient's medical history, electroencephalogram (EG), and imaging tests like MRI or CT scans. Can seizures be prevented? While not all seizures can be prevented, individuals with epilepsy may reduce their seizure frequency through medication, lifestyle changes, and stress management. Are there any natural remedies for seizures? Some people explore complementary therapies like yoga, relaxation techniques, and dietary changes to manage seizures. But these should be discussed with a healthcare professional. Is epilepsy genetic? Epilepsy can have a genetic component, but it can also result from various non-genetic factors. Can seizures cause brain damage? Prolonged or severe seizures can potentially cause brain damage, emphasizing the importance of prompt and effective treatment. Can you drive if you have epilepsy? Driving regulations vary by location, but people with epilepsy may need to meet specific criteria and have their condition well controlled to drive legally. What is the ketogenic diet for epilepsy? The ketogenic diet is a high-fat, low-carbohydrate diet that can help some individuals with epilepsy manage their condition. Can seizures be a one-time occurrence? Yes, a single seizure does not necessarily indicate epilepsy. It could result from a specific cause, such as a fever or head injury. What is a seizure aura? A seizure aura is a warning sign or sensation that some people experience before a seizure occurs. It can vary widely between individuals. Can alcohol trigger seizures? Alcohol can lower seizure thresholds in some individuals, making them more susceptible to seizures. It's advisable to drink in moderation or avoid alcohol if it's a known trigger. How long does a typical seizure last? The duration of a seizure can vary, but most seizures last for a few seconds to a few minutes. Can seizures happen in sleep? Yes, seizures can occur during sleep, known as nocturnal seizures. Can women with epilepsy have children? With proper medical guidance, many women with epilepsy can safely become pregnant and have children. Medication adjustments may be necessary. What is the role of surgery in treating epilepsy? In some cases, surgery may be an option to remove or disconnect the area of the brain responsible for recurrent seizures. What is the status epilepticus? Status epilepticus is a medical emergency characterized by prolonged continuous seizures. Immediate medical attention is required. Can seizures be controlled with medication? Many people with epilepsy can achieve seizure control with appropriate anti-epileptic medications prescribed by a neurologist or neurosurgeon like Dr. Rao. Can seizures be cured? While epilepsy is often a chronic condition, some individuals may outgrow it, and others can achieve long-term remission with treatment. Dr. Rao and Dr. Rao's hospital. Dr. Rao, an experienced and renowned neurosurgeon, along with Dr. Rao's hospital, is dedicated to providing comprehensive care for individuals with neurological conditions, including epilepsy and seizures. Their commitment to cutting-edge treatment and patient well-being is reflected in their efforts to improve the quality of life for those with neurological disorders.